Still feeling tired? Trouble losing weight? Difficulty falling asleep or staying asleep? Have you had your thyroid retested and the TSH is normal? Is your doctor telling you the medication is working and the thyroid is now functioning? So why are you not feeling better? Well, I'm going to explain to you a little bit about the thyroid, and you will see that there's more to just screening for TSH. It all starts in the hypothalamus, which releases TRH to the pituitary, the master control of the thermostat. When the thyroid hormone gets low, it signals to the pituitary to release TSH to the thyroid and make more hormone. The TSH is what you have checked to determine if your thyroid is functioning. The thyroid then combines iodine and tyrosine to produce 93% T4 and 7% T3. The T4 and T3 then hop on a taxicab, which is a protein called TBG, which then takes it to the liver. Inside the liver, approximately 60% of T4 is converted to T3. It is dependent on selenium and zinc for conversion. The other 20% is converted in the gut and 20% in the peripheral tissues. So if you have a healthy gut, this 20% is converted in an active free form that is used by your body. The taxicab then travels to the cell, and every single cell in the body has a receptor site for thyroid hormone. So, if your thyroid is slowing down, your doctor probably told you your TSH is high and T4 is low, so he put you on medications. When you take the medications, your T4 goes up and your TSH goes back to the normal range. Now, the TSH is the gold standard test, but only is working on 3 steps. What about the 7 other steps? One of the steps our body needs is proper neurotransmitter levels of serotonin and dopamine. These are the happy hormones. So if you're not getting enough, it can bring on depression. Cortisol, which is our stress hormone, can affect how your thyroid functions at the hypothalamus, pituitary, and liver conversion sites. We need proper progesterone for our taxicab to form and show up. If we don't have enough transportation, the thyroid hormone is not going to get to the receptor sites and into the cell. We need supplements such as selenium and zinc to help the conversion of T4 to T3 in the liver. A healthy gut is super important. We only make 2 teaspoons of thyroid hormone per year. If we lose 20% due to an unhealthy gut, that is a lot. Constipation can be a sign of an unhealthy gut. All the bad foods, toxin, and inflammation affect the 20% of thyroid function. Then at the receptor site, the T3 needs to fit into the cell perfectly. If something is blocking the lot, the key won't fit in. Plastics are the #1 reason why the key doesn't fit. Estrogen is another factor that can affect this reception. If the receptor site is blocked, then the signal never makes it to the cell. Lastly, the #1 cause of hypothyroid is Hashimoto's, an autoimmune disease. This is when our immune system attacks our thyroid. The most overlooked gland in the entire body is the thyroid gland. And did you know most of your immune system is within your gut? So if your gut is not healthy, your body has difficulty suppressing the immune symptoms. One of the main triggers for autoimmunity of the thyroid or Hashimoto's is gluten, the protein found in bread, pasta, or pizza. There could be other triggers like dairy, soy, or sugar. The solution is to manage and modulate the immune system. Most of you have never had your antibodies TPO or TBG tested. Supplements like D3, omega-3, and glutathione help support the immune system. Proper testing must be done to include a complete thyroid panel and a complete metabolic panel to look at overall blood chemistry. This is important to get to the underlying cause of your thyroid problem. Adrenal testing is also important if you're having difficulty sleeping or high stress to measure cortisol levels. Once the cause is determined, natural solutions could help support the thyroid to function more efficiently. As you can see, there is much more to a thyroid function than measuring TSH or T4. We need a healthy gut, liver, adrenals, proper hormones, neurotransmitters, and we also need to make sure we get the proper amount of selenium, zinc, iron, tyrosine, and proper methyl groups for a healthy, functioning thyroid.